So this is an in-service on cranial bone flap storage. You're okay.
Can I get a blow flap pack, please?
So these are stored in the core, in the ortho side and on the neuro side, and I'll show you that in a moment. You open the storage pack, so it takes all that out. If you come close, Ben, you can show the instructions come in the kit of what to do. And you need some cultures.
Yes, please. Give me some cultures.
So then I open culture tubes for aerobic and anaerobic. Oh, that's the gauze, huh? So do you need this?
I
This
do.
is a 3-pack system, huh?
Thank you.
So you need to open 2 packs for this. It used to be 1 pack, now it's 3. This is the peel pack portion of it, so you're gonna open 2 peel packs. So it's the sterile peel pack pouch that you're opening, and the autograph cranial bone graft pack. And then you say what you do, use culture.
I need a pen, please.
What are you doing with your pen?
We usually take a culture of the bone flap prior to keeping it in the freezer. We hand this off to the circulator.
Okay.
Usually get the patient's MR number.
And run down the MR. 038 3773.
Patient name.
Last name Lunder, L-U-N-D-E-R. Fictitious patient. So it's good practice to use a Sharpie when you're initially doing the initial writing of this. And the gauze comes in a pack. You don't put the bone flap and bacitracin yet. After you've done the cultures, you may use the saline mixed with baci, and you can wrap bone flap.
Get the bone flap.
And this has got saline on it.
Yeah. Moist in your gauze. Another gauze. Wrap it. This is moist. Put in the first bag. What I do is get this, stick it in here so they can see.
So hold that up. Try to take the air out of that bag.
So they can see the MR number and the patient
And
name.
it doesn't freeze off in the freezer.
Get this peel pack. Shove the bone flap into the peel pack.
You can hand that one off to the circulator. Not bloody, okay?
So it looks like still the MR number.
And then I put the name tag on the outside of the peel pack. And the inside contents is sterile. You don't want to put it on the outside of the bag because it'll freeze off into where we keep the sterile deep freeze at. And we can turn off now, and then we keep the two parts of the bone flap here. Here's the sterile peel pack that you saw Ed use, and here's the actual kit. I'm gonna put these back. The other place that you keep the storage for the cranial bone flaps, part 1, part 2, and our deep freeze. Once we have our cranial bone flap labeled and contained, I should have brought it with me. If you place your cranial bone flap inside of the freezer, you need to get the binder, and it is labeled cranial bone flap graft logbook. And inside, you'll have to come in again. There'll be a place for the patient sticker, your surgeon's name, the date and time, and that you did send cultures. You leave this for later, and then you write the circulator and your scrub tech. So let's say that I've done that. I've logged that in. I'm going to place this inside of the deep freeze. You can see it's properly labeled on the inside, sterilely on the outside with patient name. And we keep these bone flaps in the bottom. And you can see all these other ones that have been properly stored, and we will store that there. Days or months later, the patient may come back for reimplantation. And once again, you get your book, you look up your patient's name, you write, here's the inside, here's the outside. So you put the label back and you write reimplanted, or if they have not been reimplanted, say the patient expired or they disposed of someone else, will put that information there. And before you do reimplantation, the day that you realize that you're getting a reimplantation, on the schedule, you need to look up the cultures for that patient and make sure that they are negative. If they are positive, notify the surgeon, and they will not use that because it's positive cultures. And then once it's negative, you go through the steps of reimplantation, and there's a cheat sheet that's kept here, I put in the other room, that tells you the defrosting and all of the important information that you need before implantation.